Hi everyone, this is Lingana Gugulot, your pharmacy student, and today we are going to discuss about the pharmacodynamics. In pharmacodynamics, we discuss about the what is pharmacodynamics, principles of drug action, mechanism of drug action, and receptor pharmacology. So don't be late, let's get into the video.
Pharmacology. As we all know, the pharmacology is the cornerstone subject of this science. In simple terms, we can say that we have to study the effect of drugs and the drugs deals with the body. Looking to the definition of pharmacology is the science of drug and it deals with the study of drugs and the interaction with the living system. There are two types of branches classified in pharmacology. First one, pharmacokinetics, and second one, pharmacodynamics. In pharmacokinetics, what body does to the drugs, and in pharmacodynamics, what drugs does to the body.
In previous video, I have explained about the pharmacokinetics in detail. If anyone has not seen that video, for your reference, I have provided the video link in the description. So go and watch it. And for today, our topic is about pharmacodynamics. In this, we discuss about the what is pharmacodynamics, principle of drug action, mechanism of drug action, and receptor pharmacology. So, what is pharmacodynamics?
Pharmacodynamics refers to the study of how drugs affects the body and it involves the understanding the mechanism of action, the relationship between the drug concentration and their effects and the interaction with the receptors and their biological system. Key concepts includes of pharmacodynamics are mechanism of action, dose response relationship, therapeutic window, efficacy and potency, side effects and their potency. In simple terms, we can tell as the pharmacodynamics is the study of action of drugs on the body and their mechanism of actions. Going to the topic of principle of drug action. In principle of drug action, the drug produce their effect by interacting with the physiological system of the organism, and there are six basic steps of drug action that can be broadly classified as stimulation, depression, irritation, replacement, cytotoxic action, modification of immune status. Stimulation. In pharmacology, the stimulation refers to the enhancement of physiological and psychological function through the administration of certain drugs or compound, and this can include increase in alertness, energy, mood, elevation, and cognitive function. In simple terms, the stimulation can be referred as it is the increase in the activity of specialized cell. Example: adrenaline stimulates the heart. Adrenaline binds to beta-1 adrenergic receptor, which is located in the heart muscle, and it results in the activation of this receptor, increases the heart rate and enhancing the firing rate of SA node, and it also increases the force of contraction by enhancing calcium influx during each heartbeat and improving the overall output. Depression. In pharmacology, the depression refers to a mental health disorder characterized by persistent feelings of sadness, hopelessness, and lack of interest or pleasure in daily activities, and it requires pharmacological intervention for management. In simple terms, the depression can be referred as it is the decreased activity of specialized cell. Example: quinidine depresses the heart. Quinidine is an antiarrhythmic medication that primarily works by blocking the sodium channels, which result in decrease in rate of depolarization, and this results in slower conduction of velocity in the myocardium. Third one is irritation. In pharmacology, the irritation refers to an adverse reaction that occurs when a drug causes discomfort or harmful effect to the tissue, and this can happen through various mechanisms and affect different body systems. In simple terms, the irritation can be referred as it can occur all types of tissues in the body and make result in inflammation, corrosion, and necrosis of the cell. And example for the irritations are the intravenous drugs and topical agent. In intravenous drugs, certain drugs can cause phlebitis when it is injected, and in topical agents, some creams and ointment can cause dermatitis or localized allergic reactions. Fourth one is replacement. In pharmacology, the replacement refers to the therapeutic strategy of providing a drug substance to compensate a deficiency or loss in the body. And this approach is commonly used in various medical conditions where the body lacks of necessary component of normal physiological functions. And in simple terms, drugs may be used for the replacement when there is a deficiency of natural substance like hormones, metabolites, or nutrients. Example of replacement is insulin used in diabetes mellitus. Insulin is a replacement therapy. It is a fundamental treatment for diabetes mellitus, particularly in type 1 diabetes and advanced type 2 diabetes. It aims to maintain the blood glucose level within a target range and prevent the complication. There are two types of diabetes: type 1 diabetes and type 2 diabetes.
Type 1 diabetes is an autoimmune condition where the pancreas produces little to no insulin, and type 1 diabetes requires lifelong insulin therapy. In type 2 diabetes, it is characterized by the insulin resistance and eventually insulin deficiency. Insulin is required if the blood glucose level cannot be controlled with the oral medication. And next, we are going to the cytotoxic activity. In pharmacology, the cytotoxic refers to the substance that are toxic to cells. These agents are commonly used in cancer treatment to kill or inhibit the growth of malignant cells. In simple terms, the cytotoxic can be referred as it specifically acts in destroying the infective organism. Example, penicillins. Penicillins are primarily antibiotics which are used to treat the bacterial infection but not cytotoxic agent for cancer treatment. Actually, it is an antibiotic that primarily targets bacterial cells by interfering with their cell wall synthesis. Moreover, penicillins work by inhibiting the enzyme transpeptidase, which is essential for forming crosslinks in bacterial cell walls, and it ultimately leading to cell lysis and death. And the last topic of principles of drug action, it is modification of immune status. In pharmacology, it refers to the intentional alteration of immune system functions through various pharmacological agents. This can involve either immunosuppression or immunomodulation. In immunosuppression, it is the intentional reduction of immune system activity to prevent rejection of transplanted organs or to treat immune disorders. And immunomodulation, it refers to the alteration of immune response through various pharmacological agents aiming to enhance and regulate the immune function for their therapeutic benefits. In simple terms, it is also known as and vaccine and sera act by improving our immunity while immunosuppressant act by depressing the immunity. Example, glucocorticoids. Glucocorticoids are the class of corticosteroids and they play a significant role in regulating inflammation and the immune response. In next video, we'll discuss about the mechanism of drug action and receptor pharmacology. So I hope everyone like this video. So please like, share, and subscribe to Pharmacy Student.